All right, everyone. Well, in the essence of time, because we have a packed hour for you today, we are going to get started. I know there are a few people that are still going to be joining us, and we will just let them join and join in the fun. If you have any questions, please put them in the question and answer. But in the meantime, I just want to open up our conversation today. My name is Erin Jones, and I work here at the March of Dimes as Legislative Counsel. And it's my honor to welcome you and thank you for joining us today. We are excited for this very packed, informational, actionable next hour for you. I think you're going to find it very interesting, and I hope that you find at the end of this that you cannot wait to contact your legislators. We are going to do a couple of housekeeping things for you this first. So we are recording so that today's presentation is available for those who couldn't join us today. It'll also be made available on our website after the presentation. We are using both the chat and the question and answer features today, so please feel free to put your question and answers in. We have staff that are monitoring the box to try our very best to get everybody's questions answered. And if we don't get your question answered, we will make sure that you have a place and a way to contact us so that we can do that for you. And please feel free to use the chat box. I know lots of us are getting used to using Zoom as a way to meet and greet and let people know that you are here and present. So without further ado, we're going to get started, and we are going to introduce our speakers for today. So our speakers today are going to provide us with a fantastic opportunity to learn more about the omnibus federal legislation and how you can become an advocate yourself for maternal health, as well as learn a little bit about what's going on in California around their Omnibus Act and their movement. So first, I want to introduce our first speaker, who is Jack DiMatteo. Jack DiMatteo is from Representative Underwood's office, who is one of the original co-sponsors of the Omnibus bill on the House side. Jack is the legislative assistant in the office of Congresswoman Lauren Underwood, where he covers the work on health policy issues, including the Black Maternal Health Caucus. He also works on Social Security, veterans, and foreign affairs issues. He is a graduate of LaSalle University, and he got his master's degree in public policy at the University of Virginia's Frank Batten School of Leadership and Public Policy. DiMatteo started in Congresswoman Underwood's office as a 2019-2020 David A. Winston Health Policy Fellow, and he is from Deerfield, Illinois. We also have, after Jack, Kim Miller-Tolbert, who is from Senator Cory Booker's office, who is one of the co-sponsors of the Omnibus Act on the Senate side. Kim currently serves as a policy advisor for Senator Cory Booker. Through this role, she assists Senator Booker in his work to increase access to quality, affordable health care, and improve the health and well-being of Americans. She has the privilege of working with several partners, including Representative Underwood's office and March of Dimes, on issues of maternal health and on the Black Maternal Health Omnibus Act specifically. She's looking forward to her continuing work with these and other partners to see the entire Omnibus pass this Congress. Outside of work, Kim likes to cook and try new recipes and enjoy the outdoors. So without further ado, I'm going to let Jack take over and start our conversation.
Thank you so much, Erin, and greetings, everyone. I'm honored to be here with you all, excited. We scheduled the date for this a few weeks ago, and it just so happened that we're gathering one day after a very big update on the Black Maternal Health Omnibus Act that you might have seen, which is that the first bill in the Omnibus passed in the House of Representatives yesterday. The Protecting Moms Who Served Act, which is one of the titles of the Omnibus that focuses on maternal health outcomes for veterans. This bill passed the House with unanimous bipartisan support yesterday. So a really exciting update, and we're hoping that we can carry this momentum forward on the Senate side, which I think Kim will be talking about later on, to get this individual bill passed, and also carry that momentum forward to get the entire Omnibus passed. So just to open up, I wanted to give a little bit of background on the Omnibus itself, and then kind of turn it over to my smarter counterpart, Kim, to go through our strategy and how Congresswoman Underwood and Senator Booker and other leaders in both the House and Senate are trying to carry this work forward. So to step back a little bit, for those of you who, apologies if you're having difficulty hearing me, I'll try to hold my mic up, but just let me know if you're having issues with the volume. So, Congresswoman Underwood first introduced the Black Maternal Health Omnibus Act in March of 2020 with then Senator, now Vice President Kamala Harris, Congresswoman Alma Adams, who's the co-founder and co-chair of the Black Maternal Health Caucus with Congresswoman Adams, with Congresswoman Underwood. And then, we had about 70 members of the Black Maternal Health Caucus here in the House. The goal of the Momnibus was to build on existing legislation. So some of you might be familiar with some other really critical legislative initiatives in the maternal health space, like extending postpartum Medicaid coverage from 60 days to 1 year. We know those efforts have been underway, as well as others. The Momnibus was designed to fill some gaps, because we know that this really is a multifaceted issue and demands a comprehensive approach. And that's what we were trying to do with the Momnibus. So Congresswoman Underwood really set out to engage with stakeholders like March of Dimes and many of the organizations that I'm sure are tuned in today for this conversation, and really listen to families impacted by this crisis, community-based organizations doing the work all across the United States, and developing policy solutions that could address every clinical and non-clinical driver of adverse maternal health outcomes, with the goal of saving lives, ending disparities, and achieving true justice and equity in maternal health outcomes in the United States. So the result was the Black Maternal Health Momnibus Act, which was introduced, like I said, in March 2020, and then reintroduced by Senator Booker, Congresswoman Underwood, and I think we're now up to more than 150 co-sponsors between the House and Senate combined in the 117th Congress. So the Momnibus includes 12 different bills. Like I mentioned with the Protecting Moms Who Served Act, we introduced each of those bills individually and then all together as part of the Black Maternal Health Momnibus Act. So these are pretty wide-reaching. We have bills on social determinants of health like housing, nutrition, and transportation. We have bills on clinical factors, investing in growing and diversifying the perinatal workforce, ensuring that we can provide trainings on bias and racism to maternal health care providers, and then focusing on some specific groups, whether that's moms who are experiencing mental health conditions and substance use disorders, whether that's veterans, like the bill that passed yesterday, incarcerated people and our Justice for Incarcerated Moms Act that Senator Booker leads on the Senate side with Congresswoman Presley here in the House. And the goal is really to break down, again, every single dimension of this crisis and advance data-driven, evidence-based policies that center the voices and experiences of families impacted through our policy solutions. So like I said, I'm going to defer to Kim on, some more details on kind of what our strategy has been. But right now we are really focused on trying to move these individual bills forward, like we did with the Protecting Moms Who Served Act yesterday, and then advance this comprehensive package as a whole. This conversation that we're having today could not be coming at a better time. I think we're really at a critical moment as recovery packages are coming together and conversations are being had about what could be included. And we really could use your help and support in ensuring that we get those policies from the Black Maternal Health Momnibus Act included in this next package, advancing through committees in Congress. And your voices and your advocacy will be so critical in building the support to move that forward. So I want to make sure we have plenty of time for questions. So I want to make sure I also turn it over to Kim now here to provide some more details, but I look forward to the conversation for the rest of the hour. Thanks.
Well, thank you so much, Jack. I so appreciate that run through. It's always helpful for me, and appreciate your leadership and of course your boss, the amazing Representative Lauren Underwood's leadership. So I'm Kim Miller-Tolbert. I work with Senator Cory Booker, and the senator is so excited to be taking on the Black Maternal Health Momnibus Act in the Senate this year, following the amazing lead of our now Vice President, Kamala Harris. And so I first want to talk about Senate strategy, which is very similar to the House strategy. So we're following the lead of our amazing House leads of the Momnibus this Congress. And in addition to the overall comprehensive Momnibus bill that the senator introduced, each of the individual 12 provisions, 12 bills, 12 titles of the Momnibus have been introduced as a standalone as well. And so that is the Justice for Incarcerated Women's Act, which Jack referred to, and every single other bill, ranging from legislation that touches mental health, legislation that looks at environment, legislation that looks at COVID-19 and the impact on birthing people. And so we're very excited in the Senate to have that. And I think that speaks really well into sort of what our strategy is here. So we absolutely, and the senator wants the bill to pass completely. That would be fantastic. But we know that sometimes that there are packages that are moving that are better for one bill or another to get attached to. So for example, if there's a bill moving out of the Veterans Affairs Committee, that would be a perfect way to include this vets bill that just passed out of the House. If there's a package moving through the Judiciary Committee, that could be somewhere where the Justice for Incarcerated Moms Act comes in. And so that's why, in addition to the overall Momnibus bill, we've also done it this way, again, following the fantastic lead from the House this year. But as Jack mentioned, we have some amazing momentum right now to get the entire Momnibus passed. And some of that's going to be the upcoming stimulus packages and recovery packages that Congress is working on with the Biden administration. And if for those of you who have seen what the Biden administration is proposing for some of these next packages, they have said that maternal health will be a focus. And that's where we're coming in, and we're humbly asking for your help because we are really hoping that will include most, if not all, of the Black maternal health Momnibus. And so I think some of the ways that you all can help us is reaching out to your members of Congress. As Jack mentioned, we have a lot of folks on, and I should say in the Senate, some of these bills are bipartisan as well, which is really fantastic, and they have been in the House as well. But if your representatives, whether they're Democrats, Republicans, ask them to sign on, of course, to the overall Momnibus, but also, ask them to check out each one of the 12 standalone bills too, if there are any that they, would particularly like to throw their weight behind and co-sponsor as well. And then reaching out to, letting the administration know that this is a priority of yours, letting, again, your members of Congress know that this is a priority and that you want this, you want to see this bill passing this Congress, and hopefully sooner than later. That would be an incredible help to us in Congress. Our members, Senator Booker, Representative Underwood, are sort of leading the charge, but we can't do this without the support of all of you. So with that, I'm happy to, Jack and I, to answer questions, and just very grateful for all of your time and your support.
Great, thank you, Jack and Kim. Do we have any questions? I did see one in the question box. I think someone asked if we're going to have any detailed reports. That is coming. We will have, in this presentation, you're going to learn more about details of the Momnibus bill in each of the pieces. Any other questions coming in?
Yeah.
Okay, we do have one question.
Mhm.
Is there anything that addresses unnecessary cesarean sections? Jack or Kim, do you want to jump in on that?
So the Momnibus itself does not legislate clinical guidelines. That said, there are a lot of provisions in the Data to Save Moms Act that focus not only on data collection improvements that we need to make, but also quality measures, taking a review of the quality measures that already exist, assessing how we could improve those and ensure that equity is centered in some of those approaches. I know this has been a real focus of a lot of state-based efforts. It's a goal that has been set for hospitals and other birth centers and birth facilities, is reducing rates of unnecessary C-section births. So one thing that I'd flag for you that the Black Maternal Health Caucus has been engaged on is working through the appropriations process. Congresswoman Underwood is a member of the House Appropriations Committee. And one of the things that we're pushing for this Congress is funding for perinatal quality collaboratives. A lot of states have these PQCs, as they're known. And for example, the Perinatal Quality Collaborative here in Illinois, taking a look at C-section rates is something that they're doing, and ensuring that hospitals, birth centers, and other facilities have the resources that they need to ensure that not only we have excellent quality care, but that we're really pushing birth equity. So hope that answers your question. No policies that specifically legislate clinical guidelines, but really making sure that we're taking a look at those quality measures that will ultimately have downstream effects on the care that's provided in hospitals and other birth settings.
Great, thank you, Jack. I do have another question that came in. What is, if either one of you can answer this, do either one of you think there is a big piece of the legislation that's probably more probable to pass versus the other? So if there's any particular piece, maybe the House is particular about, or the Senate, anything that you think will reign over the others?
I can start that, and then Jack, please come in. So what I will say again, and to just reiterate, our goal is absolutely to get every piece of this passed, this Congress, passed or otherwise implemented. I think, as with any legislation, if it's bipartisan, it is going to have a better shot of getting through, or I should say an easier shot of getting through, right? And so in the Senate, the veterans bill, that is also bipartisan, and we are currently talking with the sponsor of that piece, Senator Duckworth, to ensure that we can follow the House's great lead and get that passed as well. There's also the Tech to Save Moms' Lives, that is also bipartisan. And I think there are other pieces of this that if they're not bipartisan now, we are actively working on it, because they're, and really this whole idea, the whole momnibus, right, is it should be a bipartisan idea. And so I would just call out those specifically to say that that they may have an easier time, but certainly our goal, our hope is to get every piece of the momnibus passed.
And I'll add, if I may, that on the House side, the Moms Matter Act is also bipartisan. So that's our bill that focuses on maternal mental health and substance use disorders. I think Senator Gillibrand is the Senate lead and working hard to make that bipartisan on the Senate side. But Congresswoman Lisa Blunt Rochester, a Democrat from Delaware, and Congressman John Katko, Republican from New York, are the two co-leads of that bill on the House side. And certainly echo everything Kim said. Our House strategy is to try to advance the entire momnibus, but we know that the ones that are already bipartisan definitely are geared up and ready to go for swift movement here.
Excellent, thank you. We have a few more questions, if you guys don't mind taking a few more. Let's see, we have a specific question on doulas. So is there any piece of legislation that advances payments for doula services? There is an ample evidence that doula services lowers maternal cesarean rates and even improves newborn outcomes. So I'll let you guys answer that one.
Sure. So I had also seen a question about doulas and TRICARE, which I'll note again to the point I made at the beginning. One of the goals that we had with the Momnibus was to be additive and not duplicative. So things like postpartum Medicaid coverage that had already been introduced, we weren't trying to copy that legislation. And there's other legislation that I believe Senator Blumenthal has worked on related to doulas in TRICARE. In terms of doulas generally, and I would expand that conversation to all perinatal health workers, both clinical and non-clinical. There's a bill in the Momnibus called the Perinatal Workforce Act, which makes critical investments in education programs and training programs to grow and diversify the perinatal workforce. And again, we're talking physicians, midwives, CNMs, and also making investments in CPMs and CMs, and then talking about doulas, lactation consultants, peer supporters, and a wide range of home visitors, and really making sure, as Congresswoman Underwood often talks about, that women and birthing people have choice, no matter where they live. And that involves racial and ethnic diversity in our workforce. It involves urban and rural providers. We know that March of Dimes has done some awesome research on maternity care deserts. And as I think March of Dimes really importantly points out, these are not just in rural areas in the middle of nowhere. It's also in urban areas that we see counties that don't have obstetric providers. So one of the big goals of the Momnibus is to ensure that we have greater numbers of maternity care providers and non-clinical health supporters, and then also that we have greater diversity in those ranks.
Great. Thank you for that. Kim, do you have anything to add to that? If not, I've got more questions for you guys.
No, that was a great answer from Jack.
Okay. So does the bill include the leave for moms who experience miscarriages and stillbirth?
Does it include what? I'm sorry?
I'm sorry. Does it include leave for moms who experience miscarriage and stillbirths?
No, so this bill doesn't include anything on leave policies, although there are others here in the House, including some stuff that's moving right now in the House that I think is really exciting. Would certainly encourage you to check out. But again, this is a real focus on some of those drivers of adverse maternal health outcomes and trying to address some of those clinical and non-clinical factors that are not covered in other legislation.
Great, thank you. And we're going to take one more question and then we'll move on. Some of the questions that are in the chat box, in the Q&A, I'm not ignoring you, but some of them are going to be answered in the next segment. So we will get to that question. We have one more question. Are there opportunities in Momnibus to extend enhancements during pregnancy and postpartum to the full year postpartum? So important to preventing later pregnancy related mortality and severe morbidity.
I could take this one. So as Jack mentioned, with the Momnibus, we're really hoping for this to be a complementary legislation, comprehensive, but also complementary to some of the other pieces of legislation that have been out there. I know that both of our bosses agree strongly with that sentiment, and we're very happy to see the step forward in the American Rescue Plan Act on postpartum Medicaid coverage, and that's certainly something, and care, and that's certainly something that they'll continue pushing for as well.
Great, thank you, Kim. All right, well, you can still put your questions and answers into the box and we will do our best to continue to answer them. Meanwhile, we're going to get moving on to our next part of the conversation, which is going to take all the information we just learned from Kim and Jack. And so I want to introduce Maya White. Maya White is the Deputy Director of Advocacy and Grassroots here at the March of Dimes. And she's going to walk us through what it means to be an advocate. And she's going to address some of the questions that people have had around what's in the Momnibus and are there samples in a toolkit. Take it away, Maya.
Hi, everyone. Like Erin said, my name is Maya White, and I'm the new Deputy Director of Grassroots Advocacy here at the March of Dimes. And today I'm going to briefly discuss what is advocacy and then tools that we have created by March of Dimes that can really help with your advocacy efforts. So this training may be a refresher course for some, but new for others who are really starting to lay the foundation for their advocacy work. So I'm happy to have all of you here today. So what is advocacy? So simply put, advocacy is finding and using your voice. It's the process or act of raising awareness or providing information in favor of an idea, a policy, or a cause, such as Black maternal health. So when done effectively, advocacy influences public policy by providing a channel for individuals and organizations to voice their opinions. So you can do this through educating others about your cause, reforming, or creating accountability for your lawmakers. These efforts in return can sway public opinion and ultimately provide lawmakers an opportunity to respond to constituent needs. So you may hear advocacy and lobbying used interchangeably, and while they have similarities, there are also some slight differences as well. So far we've learned that advocacy is an action for change, where a person can argue in favor of a cause or an idea like Black maternal health. There's also no limit to the amount of advocacy a person or an organization such as a nonprofit can do. So some examples of that is telling an elected official how a policy affects constituents, or meeting with an elected official through a lobby day, or through meetings to educate and explain how a particular problem or issue is affecting a group or an organization. Whereas on the other side, lobbying is an attempt to influence a politician or a public official on an issue. So this can be done through direct lobbying, which is attempting to influence new or existing legislation with a policymaker, or through grassroots lobbying, where we ask the general public to contact their legislators. So a few examples of that is asking a legislator to vote for or against or amend or introduce a particular piece of legislation, or creating an online petition asking the public to contact their legislators to support or oppose a particular piece of legislation. Now, many of you on this call already do grassroots lobbying when you take action through our Action Center and voice your concerns to your lawmakers. So now that we understand the difference between advocacy and lobbying, there are many places to use these skills. So in the next few slides, we'll discuss the various lawmaking levels and the who, what, when, where, and why of engagement. So on the national level, we have the US Congress, which is responsible for passing federal legislation and appropriating funds for federal and many state programs. So in Congress, there's two chambers. First have the House of Representatives, which has 435 members based on shifting population and districts. And then you have the Senate, which is set at 100 members, which in total comes up to 535 members. Each chamber has its own leadership. So there's the Speaker of the House, you have the minority or majority leader, its own committee structure, as well as its own set of rules. So while each state has 2 senators, the number of representatives for a state really depends on the state's population. So in state legislating, state legislatures vary in size. So most legislatures are divided into a Senate and then a House or an Assembly, or may just have one chamber. There's also 2 main types of legislative sessions: regular, which really holds a lot of the state's business, and then special, which can be held to address a specific issue or issues that weren't addressed during the regular session. It really just depends. There's 46 state legislatures that meet annually, but there are 4, Montana, Nevada, North Dakota, and Texas, that hold sessions every other year. Also, state legislatures use their own terminology. So for one state, they may call a bill a certain thing, but in another state, they may not. It just depends. So there's many options of where and how and when you can lobby that works well with your lobbying strategy. So because of the pandemic, a lot of our lawmakers are moving virtually, so you can meet with them over video, phone, email, or social media, fax if needed. But also you can meet with your lawmaker in their federal office with their federal team while in session, or at their home district when Congress is out of session. I think that there is not really a wrong time to really reach out to your lawmaker, and you can reach out to them prior to a session, during a session, a day of a hearing, a day of a vote, and also following up with them after a decision has been made. So even though we hear that lawmakers are the ones that you need to speak to, there are many people who help influence and sway their decisions. So when you're lobbying, you can lobby a legislative committee member and their legislative leadership, a sponsor or a co-sponsor of a piece of legislation, really all members of Congress on both sides of the aisle, the legislative staff, state agencies, and also the executive branch. So to find your representative, there's many resources online where all you need to do is enter your address or even your zip code, and you will be able to find your lawmakers on both the federal and on the state level. So when working with elected officials, one thing that you really should know is lobbying is all about education, educating about the problem and the potential solutions. So when you meet with your lawmakers and their staff, you want to provide them with tools and resources that tell about your issue in a clear and succinct way, such as fact sheets and issue briefs, which we'll get to momentarily. You only have a short amount of time to get your point across. Lawmakers and their staff are inundated with a variety of issues, so they aren't always subject matter experts in the issues that are important to you. So if you're given the opportunity to meet with their staff, make sure you stick to the facts. Less is more. Have a clear and stated problem and a solution. Also, feel free to share a story about how this issue has affected your life, as well as a proposed solution on how it can make a difference. You also want to play to the lawmakers' passions, as well as know what motivates their decision making. Also important to know that to keep in touch with their staff. So their staff is so important to lawmakers, and keeping that relationship going throughout the years, as well as through lobby days and legislative fly-ins, can become beneficial. So I want to switch quickly to discuss resources that March of Dimes has created to help you reach out to your lawmaker. So I encourage you to visit marchofdimes.org/momnibus, where you can do a couple of different things. One, join our Advocacy Action Network and contact your legislators about the Momnibus bill. Two, utilize our social media toolkit with recommended social media language and graphics that you can use, but also you can share with your family and friends. And then rewatch this webinar in case you missed any information, or share it with someone who was not able to join us today. And finally, on the page, we have a Becoming an Advocate PDF that is compact about the Momnibus bill, where you can, there's detailed information and background information about the Momnibus. It also has downloadable and customizable materials for your advocacy and outreach. So we have fact sheets, talking points, op-eds, and other resources that you can use. So please make sure you go to marchofdimes.org/momnibus. And if you have any questions, please drop them in the chat box or the Q&A portion, and I will turn it back to Erin.
Thank you, Maya. Thank you very much for that. I'm just going to check the Q&A here and see if we have any specific questions for you. Our friends are keeping up with the answering of questions, so it looks like we don't have any questions at this very moment. So we will move on to our next presenter. I am pleased to introduce Crystal Yelverton. She is our executive director at the March of Dimes in both Los Angeles and Orange County and Inland Empire Market in California. And she is going to go through state advocacy in California. Thank you, Crystal.
Thank you so much, Erin. And I am excited to share about our California Momnibus. We are reimagining maternal health for all birthing Californians. As you'll see on our next slide, our goal is really similar to the federal Momnibus. We are focused on closing the racial and socioeconomic gaps around maternal health disparities. There are 7 provisions that we have in this bill focused on improving maternal outcomes. We are improving access to doula care. We're working on the data to access outcomes. And why that's an important piece of this bill, right now, there is no consistent collection of data when we see loss of infant life. And if we can really get our arms around the statistics so we can better understand the issues, we'll be able to strategize so that we can improve and really improve those outcomes. We're extending medical coverage for 1 year postpartum, which is so critical for our moms to ensure that they don't fall out of their medical coverage within that year following birth. And then this bill for us has been double referred in the Senate. It's got bipartisan support. So we feel like we've got a bill that's encompassing all things when we're looking at eradicating those disparities. So what are we doing to move forward? The next slide will really focus on how we actually advocate for this bill in the state of North Carolina, or in the state of California, excuse me. This issue is clear. Despite the reduction of the overall rate of maternal mortality, we continue to have sharp racial disparities. Our state has 9 counties that we consider maternal deserts. You heard about those earlier. So there's no doubt our need is clear and critical. One of the first steps, I think, is really identifying and aligning with the right partners. Who are our collaborators? Seeking those statewide and those local organizations with common mission, common goals, and really aligning with them to get the work done. We've got 6 other organizations in the maternal and child health space that we collaborate with on this bill, along with a host of supporters across the state. And what we're doing is really the research, reviewing the data, identifying what programs or potential policies exist or could exist to provide solutions so that we really could develop those components, those 7 provisions that I shared with you all. I would also add that our partnership with our legislative champion, here we've got Senator Nancy Skinner in California, who is sponsoring this bill, and having her and her team on board truly is critical. It helps us with our legislative conversations. It gives us a home for the bill, really. And that, I think, is critical when we're talking about what we can do so that we can improve those outcomes. And then the action that we've taken, I have to admit, our virtual lobby days have been phenomenal. And why they've been so great, typically we would travel to the state capitol, and that's restricted for some folks that aren't able to make it up to Sacramento. But being able to bring these virtual lobby days right to where our constituents are have really allowed us to have a broad and diverse representation of constituents in the different districts of the legislators we've met with, so that they in turn can speak to members within their district who have a concern around these issues, sharing their personal stories, sharing their professional connectivity when appropriate. So these virtual lobby days, we actually wrapped up one yesterday, meeting with 2 of our legislators, are key. Another action members of our coalition and supporters take is providing testimony when our bill is heard in different committee hearings. This is something that may go on throughout the cycle. We've actually had staff and volunteers testify for this bill in recent weeks, and we are being heard this upcoming Monday in the Appropriations Committee. And while we don't anticipate needing testimony, our coalition remains on standby so that we can put someone forward if that need arises. So as you can see, there are quite a few ways that we take action in support of our State Bill 65, really trying to reimagine that health of all Californian birthing people. Thank you all so much. I'll turn it back over to Erin.
Thank you, Crystal. We appreciate you going through that and what's happening in California. So I'm going to look at our question and answer because we do have some time to go back to some of the original questions and even more that came in. So Jack and Kim, you're on cue here. We've got some more questions coming in. Will all states be required to follow the guidelines if these bills pass?
So there are not necessarily like binding guidelines in the bill, but all the provisions of the Momnibus would be applicable nationwide. Apologies if I'm not understanding the question fully, and I'd be happy to answer any follow-ups. Kim, I don't know if you had anything on that.
It came in anonymous, so if the person wants to ask that question, wants to clarify a little more, we'd be happy to try to do that for you.
The one thing I will say, to the point that Kim made about what was included in the American Rescue Plan about extending postpartum Medicaid coverage, that was an optional provision for states. And Kim, I'll let you actually speak to the bill that Senator Booker has introduced, which includes a mandatory version of that policy.
Yeah, thank you so much, Jack. Right, that is exactly right. It was a fantastic step forward, but it is only an option. And What we fear is that there will be states like New Jersey and like Illinois actually has that will take up this option and do right by their moms, by their birthing people. But as we've seen with the ACA's Medicaid expansion, we fear that there will be states that simply won't. And so Senator Booker just last week introduced legislation or reintroduced called the Mommies Act. And that legislation, among other provisions, would make it a requirement for states to provide up to 12 years or 12 years, excuse me, 12 months of postpartum Medicaid coverage at a minimum for new moms. And so again, American Rescue Plan Act, we're very proud, we're very happy of that step forward there, and we're going to continue to push forward.
Great. Thank you, Kim. Thank you, Jack. One more question. Does this bill protect both women on welfare and women with personal insurance?
I assume like private insurance maybe, but yes.
I think that's what they mean, yes.
Sure, yeah. All of the, programs in the Momnibus are broadly applicable. So you have things like an extension of eligibility for WIC, nutritional support for women, infant, and children. That is extended for the Momnibus from the current period of 6 months for postpartum people and 12 months for breastfeeding people to 24 months each. But then you have other provisions throughout the Momnibus, like the Perinatal Workforce Act, that are, ensuring that we have a larger and more diverse perinatal workforce. And that's important for moms of any insurance status, anywhere on the income distribution. Something that I'm sure you all know about this crisis is that these disparities persist across education levels and income brackets. And there's very high profile stories like Serena Williams, who have had these experiences themselves. And so, we really want to ensure that the protections that are in place for women and birthing people are broadly applicable across all insurance statuses and all backgrounds.
Thank you, Jack. One more question that just came in. Is there anything being done for undocumented women?
This would be one of those issues that falls into other legislation. I think there was actually just a bill, Kim, I don't know if you have more information about it, a HEAL for immigrants bill that was just introduced. So again, an effort to not be duplicative, but Kim, I don't know if you have any more information.
Yes, the bill you're talking about is the Heal for Immigrant Families Act. Representative Jayapal introduced that on the House side, and Senator Booker introduced that just yesterday on the Senate side. And exactly what Jack is saying is that would address some of the concerns that undocumented and other immigrant communities face, and is certainly complementary legislation to the Momnibus. I do believe, and Jack, please correct me if I'm wrong, I do believe the social determinants piece of the Momnibus, that there are pieces there that would look at undocumented mothers. And so there, I think certainly little targeted ways that undocumented birthing people would be captured under the Momnibus. But yes, for the bill that is that explicitly deals with this and other immigrant communities, that would be the Heal for Immigrant Families Act.
Thank you, Kim.
Sorry, Aaron, I didn't mean to cut you off.
No, that's okay.
Yeah, I was just going to echo what Kim said. One of the key provisions of the Momnibus across the board is just investing in community-based organizations that are doing the work already. And we know many of those community-based organizations are serving all their patients and all the people in their community, regardless of immigration status. So we think, this is not a crisis without a solution. We see solutions in communities across the country, and we just want to make sure that those organizations have the resources that they need to continue to do their great work.
Great, thank you, Jack. Okay, let's check and see. We've got one more. This question is more specific to New Jersey, and Lisa, we will get an answer to you around advocates and organizations specific to New Jersey. So thank you for asking that question. I think that's all the questions I see so far. Doesn't mean you don't have to stop adding them in there. We'd be happy to put more. I want to thank all of our presenters today and for your leadership and also for explaining to us what's going on, and for Maya telling us how we can do it, and for Crystal giving us an example of California and how they're taking the Momnibus and making it very state specific. And now I turn to all of you. You guys all now have a chance to take action. And so we really encourage you to go to the March of Dimes website, which is marchofdimes, all one word, .org/Momnibus. And I assure you that if you go on there, you're going to be very pleasantly surprised. We have literally taken all 12 pieces of the Momnibus legislation and spelled it out for you. We couldn't do it all in 1 hour, so you're going to have to do a little bit of reading, but I really hope that you guys are able to look at it, read it. If you have questions, reach out to us. We will make sure that even Kim and Jack can answer questions if you have them specific for their office. It's a great opportunity for you to even tailor pieces specifically with your organization or you as a constituent, or your church group, or whatever group that wants to participate in this, and show your voice and your partnership with the March of Dimes and many advocates across the country that are very, very concerned about this issue. And we really want to see all 12 pieces of this bill pass and be successful. So we can't do that without you. And that's why we've created this. And it's an opportunity for you to go on and take action. You also have an opportunity to sign up for the March of Dimes Advocacy Network. So you don't have to keep going to our website. We'll come right to your phone or right to your email for you. It's a very easy process. And if you are interested in participating in a bill, you put in your zip code and it's all done for you. And so it's a great way for you to stay connected to what we're doing at the March of Dimes. I assure you that we're going to be watching this bill all the way through. And so we can help you stay on track of what's happening. And we just appreciate you taking the time to spend with us today and to be an advocate, because without you, we can't get this done. Let's see if we have any more questions. Oh, I saw one that came in. Let's see. The question is, will MOD be providing research funding or maternal mortality reduction? Oh, for maternal mortality reduction. I will have to get back to you with that, Melvina, because I am not in the research department, but we can get that question for you, answer for you. All right, well, we'll leave the question answer open for a few more minutes to see if anyone has any other questions. If not, I want to thank all of you for participating with us today. And we hope you found it as informative and as much information as we thought we were able to provide for you. So thank you very much, everyone.